Hey guys, it's Kay back again today with another CCRN question. Here we have a patient post-STEMI that develops new onset of a murmur related to papillary muscle rupture. What are the characteristics of the murmur and associated findings in this particular circumstance? A loud diastolic murmur with a giant V wave in the pulmonary artery occlusive pressure tracing or wedge pressure tracing. B, a holosystolic murmur with pulmonary edema. C, a diastolic rumbling murmur with pulmonary edema. Or D, a crescendo decrescendo murmur heard at the apex. What do you think? Well, the answer to this is B, a holosystolic murmur with pulmonary edema. Now, why? Why systolic? Well, with papillary muscle rupture, remember the papillary muscles and the chordae tendineae serve as kind of anchors for the mitral and tricuspid valves. So if you have papillary muscle rupture or tearing of the chordae tendineae, you're going to wind up with a mitral valve that is insufficient or regurgitant. So every time the left ventricle squeezes, blood scoots right on by into the left atrium across a mitral valve that really is kind of flopping in the breeze. So that would occur during systole. We know for a fact it would be a systolic murmur. And it says also here in our little story problem, that, let's see, this patient is post-STEMI, so that sets them up for papillary muscle rupture. So A, loud diastolic murmur with a giant V wave? Nope, it's not diastolic, it's systolic. Will there be a V wave? You bet there will be. A V wave represents the time in which the atria are filling. And so we see it on the right side of the heart, we see it with our central venous pressure tracing. Over on the left side, we see it with the wedge pressure tracing. And that means that giant V waves mean mitral insufficiency. But what totally throws A out of the ballpark from being the correct answer is that it says a loud diastolic murmur, and that's not true. Papillary muscle dysfunction or rupture will give you a systolic murmur. So let's talk about the other things. Holosystolic murmur, B, you bet we're going to have a holosystolic, holo meaning we hear one continuous sound throughout all of systole with pulmonary edema. That's huge. Those are huge findings. And along with that, a giant V wave in the wedge pressure tracing. C, why is C wrong? Well, it says diastolic rumbling murmur. My eyes are already going to the next answer because I know with papillary muscle rupture, it's going to be a systolic murmur. Lastly, D, a crescendo decrescendo murmur heard at the apex. No, crescendo decrescendo means that it gets louder and then softer, and that would be a murmur associated with aortic valve or pulmonic valve disease, and it would not be heard at the apex of the heart, but rather at the base with possible radiation up into the neck. So that's what makes the wrong answers wrong and the right answer right. If you need some practice going over CCRN questions, please head over to CCRNchallenge.com. I just finished writing a 150 question CCRN mock exam, of course, that is free to you. So head over to CCRNchallenge.com and pick up that exam and give it a go. You'll be able to identify areas where you still need additional study before you sit for the exam. Have a wonderful day, everyone. Bye-bye.